So, hello everyone. Welcome to another session. For the next few minutes, I am going to discuss some case scenarios based on your new Cbme curriculum. As you have seen, your immediate seniors 2019 batch question paper, the question paper is full of case scenarios. Okay, so if you fail, if you just simply mug up the facts or topics, you can't answer these questions. You should know. For that, you should practice yourself by answering some case scenarios. Of course, rather than asking, okay, explain in detail about coagulative necrosis, they will give you a history of myocardial infarction. They will ask you what is the diagnosis. Then they will ask you what is the morphological pattern of necrosis. Explain about them. This is how they are going to ask. For the next few minutes, I am going to discuss some case scenarios which may come. Each chapter we will be discussing like this. Let us start from the cell injury chapter. Okay, fine. Right, I am writing here. Number 1. I am not going to write the complete case here. I am just going to write the key words of the case. Rest I will recite. A 49-year-old male comes to medicine OPD with history of H-O, history of palpitations, sweating, severe constricting chest pain. Severe constricting chest pain. Here comes the question. What is your probable diagnosis? Diagnosis short form DX. What form of cell injury occurs? So consider question number A, question number B, question number C. Explain its morphology. Yes, you are going to answer. It's like a discussion. Okay. So what is your most probable diagnosis? Anybody? It is MI, myocardial infarction. Why? Because palpitation, sweating, severe constricting pain. 49-year-old male. Okay. It doesn't mean that no other condition will present with these symptoms. As of now, since we are discussing the questions from cell injury, we are discussing pertaining to that. Which form of cell injury? Irreversible. Why till it is irreversible? Myocardial infarction is an example of coagulative necrosis. And next, you are going to explain about the morphology. You can refer Robbins. Okay, in Robbins, what is written? So, suppose the complete question is 5 marks. For your diagnosis, 1 mark. For the second question, 1 mark. And to identify its coagulative necrosis, it is 1 mark. And to write morphology, 2 marks. 2, 3, 4, 5. Total, you will get 5 marks. Okay? Yes. Let us come to the second question. Okay, let us come to the second question. A 30-year-old male comes to surgery OPD with complaints of colicky abdominal pain, pain radiating to epigastric or epigastrium, as well as back of scapula, back of scapula. On examination, it was found to be acute pancreatitis. Acute pancreatitis. What is the key word here? They have already given the diagnosis. It is acute pancreatitis. Here comes the question number 1. What is the form of cell injury? What form of cell injury? Yes, again here it is irreversible. Irreversible. Second question, explain the morphology. Explain the morphology of necrosis. So you should know what type of necrosis occurs in acute pancreatitis. Yes? Anybody? Very good. Fat necrosis. For this 1 mark, and another 3 marks for writing the morphology. You are going to write the morphology. Fat necrosis. See, rather than asking directly, okay, explain the morphology of fat necrosis, the examiner wants you to see what are the clinical features. Okay, using the clinical hints, the symptoms and signs. Okay, sometimes they will give diagnosis, sometimes you have to find the diagnosis. In some complicated cases like acute pancreatitis and all, okay, of course they will give. Okay, as of now, because once you read the chapter of pancreas, fine, again there is very less chance that they will give this diagnosis. Then you have to find, okay, in acute pancreatitis, so it is an example of fat necrosis. So you have to go and write about that. That is the second question. Let us write the third question. A 26-year-old male comes to OPD with history of evening rise of temperature, enlarged lymph nodes, LN I am writing, cough with hemoptysis, cough with hemoptysis, loss of weight, fine, okay. Sputum was acid fast positive. This is a characteristic history of, yes, anybody? TB, tuberculosis. Okay, same question, sub questions. What form of cell injury? Irreversible cell injury. What is the form of necrosis here? Caseous necrosis. Caseous necrosis. Number 1. Number 2, they may ask you what type of inflammation. It is an example of chronic inflammation. Of course, I will tell you much detail about the chronic inflammation, okay, in another session of inflammation. And in that I will be telling we have granuloma, epithelioid, giant cells, okay. So all those may be what the sub question. I am just putting question mark because we will discuss about the chronic inflammation separately. So this is the case of caseous necrosis. Okay, fine. Yes. Now. Okay. Okay, that is third question. Fourth question. A 61-year-old male comes with palpitations, okay, weakness of limbs. On examination, his BP was found to be 189/110 millimeter mercury. So it is a malignant hypertension, very high hypertension. Weakness of limbs occurs due to, maybe it is due to cerebral infarct or cerebral thrombosis. Okay, fine. some points you may feel difficult to understand. Okay, you will go to medicine clinical posting, surgery clinical posting, so you will get familiarized with all these terminologies. Fine? Yes. 189 by 8. Yes, still it's not over. Still they will give you some hints. On histopathological examination, HPE, fibrin deposition observed. What is your diagnosis? Malignant HTN, hypertension. What form of necrosis? Fibrinoid necrosis. Third question, explain. Okay, explain the mechanism. Fibrinoid necrosis is what type of cell injury, children? Reversible or irreversible? Irreversible cell injury. You are going to explain the mechanism of irreversible cell injury. Then they may ask you another question. Give 2 examples for this. Fibrinoid necrosis, I have told you, RHD, rheumatic heart disease, am I right? PAN, polyarteritis nodosa. These are 2 examples you can remember. That finishes 4th question. 5th question. Okay, I think that covers some of the questions you may get in necrosis. Yes, 5th question. A 36-year-old male who is a IVD, intravenous drug user, intravenous drug user, comes with complaints of right hypochondriac pain. Right hypochondrium, you have the liver pain. Fine. On biochemical analysis, increased AST, increased ALT, increased GGT found. He also has a history suggestive of blood transfusion a month ago. What is your probable diagnosis? See, intravenous drug abuses, right hypochondrial pain, increased AST, ALT, GGT. Okay, mostly it is a case of probable diagnosis. You should not say the definite diagnosis. Okay, some problem with the liver and history of intravenous drug abuse or blood transfusion suggests it may be a case of viral hepatitis. Okay, viral hepatitis, most commonly hepatitis B. So that is the first question. Second question, what is the pattern? What is the pattern of injury? Okay, what is the pattern of injury? Fine? Okay. So what is the pattern of injury? Viral hepatitis, Hep B. Okay, what is the pattern of injury? Irreversible cell injury. Yes, can you tell whether necrosis or apoptosis happens? Answer is apoptosis. Answer is apoptosis. Am I right? Why apoptosis? You already know. Viral etiology, definitely the mechanism of cell death is apoptosis. Fine. Once this is done, next comes the question, what are the morphological features? See, if you don't know the diagnosis, you can't answer the rest of the question. That is the problem with the case scenarios. Fine? Yes. So what are the morphological features? You know, apoptotic bodies. What is the name of that? Councilman bodies, viral hepatitis. Then they may ask you, explain in detail about the most dominant pathway. What is the most dominant apoptosis pathway? Mitochondrial or intrinsic pathway? So this is how they are asking question these years. Mitochondrial intrinsic pathway. I hope things are clear for you. See how they are asking, how they are framing questions. Fine? Yes. No more. The university exams are easy. Okay. So that's done. That's done. Then what else in that chapter? As far as case scenarios are concerned, these are the maximum limit of the questions they may ask. And sometimes they may give you a history like this. 36-year-old male, okay, comes with the compliance of what? Some serious complaints, okay, cardiovascular system symptoms they may give, and they will give on examination. It was found that aortic valve thickening occurs, stenosis present, aortic valve thickening, stenosis present. So they may ask you what type of calcification it is. Dead means dystrophic calcification. Dead means dystrophic calcification. Dystrophic calcification. They may ask you differentiate between dystrophic and metastatic calcification. See, this is how they are going to ask questions. Don't expect single liner questions like anatomy of fallopian tube, inguinal canal, uterus, explain uterus under the following headings. No, things are going changed. Okay, yes. So this is how the questions they are going to ask. So these are some of the common questions. These are some of the common questions. What to say? They may ask. These are the common case scenarios. Okay, they may ask. I think we have discussed around 6 questions. Am I right? 6 case scenarios we have discussed. And yes, of course, from the 6 only you will get in as far as cell injury is concerned. Like that, we have around 18-20 chapters are there for complete Robbins. So of course, from each chapter, and as far as we enter the systemic pathology and all, from each chapter they can ask around 10 to 15 questions, case scenarios like this. So around total around it, there will be around 300 to 400 case scenarios will be there. From that only they will ask some 10 to 12 questions in a paper. So this is just cell injury chapter. Of course, in the coming chapter we will get lot of case scenarios. Of course, fine, we will discuss that in the due course. Okay, fine. It's a must watch video. I will be sharing the notes also, and please go through this case scenarios and try to correlate. Okay, and you yourself try to answer. Okay, what is the morphology of fat necrosis? In which organs fat necrosis is in? Which organs the coagulation necrosis? And you yourself try to revise yourself so that you can apply and see when you go to a medicine or surgery posting. Whenever you see a patient of acute pancreatitis, please see whether the patient is having the symptoms like this. Okay, then you can see okay what is happening actually. What is the pathology? You can explain. Right? Myocardial infarction means you can explain coagulation necrosis. Suppose you are excising the pancreas, and if it is sent to histopathology, okay, you can observe. Okay, you can on histopathological examination you can guess. Okay, what will be the possible findings? So this is how you should correlate the theory of pathology, or this is how you should apply pathology to the clinical subjects. Fine? Yes. So I hope it has been useful to all of you. Thank you.